This is the first time in my 27-year career that I'm able to sit down and do a drawing and complete it at one sitting.
I guess we won't talk about the Hemi engine that we discussed a little earlier.
Be more than happy to talk about it. It's incredible. I mean, it's turned me into feeling like a 25-year-old man again.
The days that we're together in the clinic, it drives me crazy. I'm like, you need Adderall, because as we're trying to get things done, he's like, wait, did you hear this? And he's like hearing a million conversations, and every distraction is getting his attention. Hi, I'm Dr. Chris Croley. Welcome to another episode of Beauty and the Brain. I'm here today with my husband, Jerry Drinkard, and we have an exciting topic to talk to you guys about, and it's NAD infusion. So NAD has been really gaining popularity in forms of oral supplementation and IV infusions, and we have a whole exciting episode for you today, including a guest. And so our guest today is James Martin, and he's going to give you some personal experience with NAD infusions.
I'm Jerry Drinkard, a family nurse practitioner. Together, Chris and I own Skin and Tonic, a med spa located here in Pace, Florida. And as you were saying, the NAD is one of our popular infusions that people receive in the clinic. It's been marketed for years. It originated in the 60s, the late 60s. It came out and was originally used for some alcohol withdrawal issues, and also for treatment of drug withdrawals, and more recently it's been used for focus, clarity, energy, and all the fun things that we want and need, especially as we age. There's a lot of ways that people can get NAD. It's a pill form as well as an infusion, which is what's most common with us at the clinic. I really didn't know a whole lot about NAD. I think we learned about it in the 10th grade during the Krebs cycle, which was something that a lot of us kind of forgot about.
You have a better memory than I do when it comes to 10th grade.
I remember the Krebs cycle because it talks about processing alcohol and getting sugar out of it. So I always thought it was interesting because of MASH and the horses, but that's a rabbit hole I won't go down. The interesting thing about NAD is that every cell needs it, and it's naturally found in every cell, even though a lot of us don't know anything about it. So NAD, just to kind of briefly talk about it, every cell has to create their own energy, and the way that we do that is with the use of NAD. And so if the cell doesn't have energy, then it has problems getting rid of toxicities that are located within the cell. And so if this cell gradually gets more toxic, then it dies, then the life expectancy is shorter. I think the thing that's most common with NAD decreases over age, and it decreases over age in everything from a single cellular yeast to a multicellular mouse to a human. We watch the decline in this, and as it declines, that's when we lose some of our clarity, our energy, the sharpness that we require. Some of the things that James is going to talk about later in the episode. You've had NAD. How did you feel afterwards?
Yeah, I didn't see the burst of energy that a lot of people talk about immediately afterwards, but after kind of completing a series, I did notice that, and almost right away, definitely some increased clarity. So it's interesting that you mentioned, I agree with all the things you just said, that many of us don't know a lot about NAD, although it's in all of our cells and it's in every one of our cells. And there's been a lot of research and studies looking around these levels and low levels and what they correlate with. So it's not real clear that low levels alone cause a specific disease or a specific problem, or if the disease or problem is, the low NAD levels as a result of having that disease. And so it's not. That being said, that doesn't mean that we can just replace your NAD and then correct whatever underlying problem is. But a lot of the things that older patients struggle with, everything from Parkinson's, dementia, some movement disorders, neurological dysfunctions, autoimmune diseases, a lot of those things are associated with low NAD levels. And so, there's still a lot of research that needs to be done, and a big question out there, if we replace those levels or if we get them closer to normal, will we mitigate some of this disease process? Are we going to slow down disease progression? Are we going to help manage some of those symptoms that patients are experiencing from the underlying underlying disease process. So I find it fascinating as well, and continue to learn more about it. And really, I'm happy with the results that we're seeing with our patients that are getting these infusions. And personally, yes, I definitely saw more focus, more clarity. We talk about a lot that I travel for teaching and for doing a lot of things with aesthetics, and travel kind of all over with Empire Medical, and that's a lot of different time zones, a lot of different sleep schedule changes, and then I still work a few nights in the ICU. And I think it helped me the most with trying to switch those schedules around, or trying to adjust to being in different areas and getting my, sleep-wake cycles back on track whenever they were way off after working a stretch of nights or traveling to the West Coast. In fact, we're talking that we both are going to do our NAD infusions this week.
Well, sleep deprivation is one of the things that has been proven to lower NAD levels. There are several other factors. Like I said, aging is probably the most common. Different metabolic injuries, like diabetes, certainly. Obesity, certainly. Exposure to the sun can lower NAD levels. One of the things interesting that can increase NAD levels is caloric deficit, which I did find pretty interesting. But regardless of whether lowering or raising it, the NAD levels are pretty dependent on everything that we do in life. And so the benefit of having our NAD at a therapeutic level is pretty amazing.
Often I get asked, what can we do naturally to increase our NAD levels? So obviously infusions is one way that we can handle it in the clinic, but they're fairly time consuming. A lot of patients can't tolerate these infusions at a fast infusion rate. So depending on the dose level, it may take anywhere from 2 hours to 4 or 5 hours to complete the infusion. And patients ask either, what can we do to try to raise this naturally on our own? Does oral supplementation work? Or if we're getting infusions, what can we do to maintain these levels where we get them with the infusions in between those times? And so you mentioned like caloric restriction or fasting, and we know that increases our NAD levels, but also exercise. That's another way that we can increase NAD levels. I know we all hate that word for the most part. We're not great at that, but it will increase our NAD levels. But there are a lot of foods that are rich in NAD as well, and will help with that. Do you want to mention those, or you want me to?
You can
I'll talk about it. And so he's like, go for it. So we're talking about like fish, poultry, nuts, pretty much anything that I wouldn't eat is going to help you increase your NAD levels. This is going to be Jerry's diet. It's what you'll follow if you want to have naturally high NAD levels. Whole grains also is a good way to help support our NAD synthesis endogenously.
And then I counteract that with alcohol, because alcohol lowers our NAD levels. So
the ways that alcohol, stress, so chronic stress, high stress situations are going to lower it. Any kind of chronic disease is going to lower it, and sleep deprivation. So when we look at that balance of what can we do to increase it versus what things are we doing that are what can we do to increase it, and what things are we doing to decrease it?
Basically a healthy lifestyle.
Yeah, it's a healthy lifestyle. That's exactly what it leads to. So we can certainly augment or help you out with infusions, but we also know that if we lead a healthy lifestyle in general by following a relatively healthy diet, some moderate amount of exercise, getting the proper sleep and stress reduction, that we're going to have probably more optimal NAD levels than in patients who don't do those things.
Yeah, and like you said, the infusions are obviously like a really easy way to get it up, but it's not, for me, it was not an easy process. I personally don't like taking the time to sit there because I do have to infuse slow. For instance, a 500 milligram infusion for me is going to take me somewhere around 3 to 4 hours, and so that's a lot of time out of my day, but the benefits of it are certainly outweighing. We'll hear some patient testimonials later regarding that, but we'll talk about some of the symptoms that you felt like during your infusions.
Kind of what I experienced is maybe more in the mild side effects. I think what you experience is more moderate side effects, and then what we see in the clinic with all of our patients. So we can certainly talk from our own personal experience, but a lot of our patients kind of fall in that mild symptom range. And so depending on the rate of infusion, you can have a little bit of chest tightness, some flushing sensation. Some patients have described described it to me like anxiety. I think one patient said it's almost like they're at the top of the roller coaster about to go down the hill, but that they never get that, kind of release. They're constantly in that state of anxiousness or awaiting, anticipating.
I feel mid-flight the whole time. I feel like I'm at the peak, headed over. But it is, it's administered through a peripheral IV. I think a lot of people don't know it's no special IV that has to be done. It's a peripheral IV that we start in the clinic. It's done. We monitor everyone closely while they're there. Those effects can certainly be controlled relatively quickly. As soon as someone starts to experience something that's not pleasant, then we can dial their dose down, and they resolve within 20 to 30 seconds.
Yeah, it's pretty quick with the IV. Once we slow down the infusion, how quickly the symptoms will actually improve. Now, there are some places out there, and we've done this a few times, but most of our patients opt for the infusion, that will give this as an intramuscular injection. And what are your thoughts on that?
My personal thought is I'm not going to do it. So that's my personal thought. I think that it would be nice to not have to sit for the infusion, but we have several patients that have done this in the past, and the primary complaint is nausea over the first couple of hours after the injection. So I think it certainly is something that can be done safely if it's done by a medical professional that's aware of the risk associated. But personally, it's not for me.
I agree. I don't like it personally either, but I think one of the things is it's usually a lower dose than we're given in the infusion. We can't control those side effects. So once we give you the injection, it's there. And although they're pretty aggravating for the first few hours, it's usually time limited. People kind of get over that within a few hours. One patient in particular says that she doesn't mind. She doesn't want to take the time to get the infusion, but she loves the result so much. She's like, I'll just go ahead and prepare myself that I'm going to be nauseous and cramp and throw up, but it's well worth the energy afterwards.
That kind of goes back into the benefits. Did the benefits outweigh that little brief period of symptoms that you have? And it is actually, it's been considered like the miracle molecule by some. And that's because of its anti-aging or age-reversing even like qualities that it has. So, people that do NAD and do it routinely, they experience like better muscle maintenance. They have better muscle memory, if you want to call it that. Their skin quality is better. Their mental quality is better. The energy level. And so when you start comparing like all these benefits versus a couple of hours of not feeling too, great, then certainly I think the benefits outweigh the risk.
All right, great. Well, why don't we invite James in and let's talk to him and hear what he has to say about his personal experience with NAD.
Sounds good.
Welcome back. You've heard all about the benefits of NAD today, and we are happy to have a guest here with us to talk about all the wonderful things he's experienced from NAD. We have with us James Martin from Gulfside Landscaping. James has been a friend of ours and a client for many years, a long time actually before he even started doing the IV infusions. James is the owner of Gulfside Landscaping in Pensacola and has designed some of the most beautiful landscapes all around this area that you guys can even imagine. So thanks for being with us today, James.
Absolutely, it's my pleasure.
Jerry, he's the one that kind of suggested that we get you in on the podcast because of how much you raved to him about the benefits of the NAD infusions that you've been receiving.
We see James in the clinic a lot, and it's one of those things that we've kind of seen a transformation of you when it was one of those almost a skeptical thing about, do I take NAD? Is it something that's going to be beneficial? And we've watched you over the course of the past few months just really like see lots of beneficial changes from it. So you want to talk to us a little, tell us what you're experiencing beforehand that led you down the NAD pathway?
Well, first, it's great to be here with y'all today, and I enjoy our friendship and our professional relationship. NAD is extraordinary. It is absolutely spectacular. The thing that made me try it first was, as a designer, I cannot take Adderall, and I have ADD. And so it said that I could get focus, energy. So the focus, anything that says focus, I'm always interested in. When I take Adderall for the ADD that I have, it prevents me from being creative. So it's impossible for me to take. So I was seeing a psychologist to assist me. This psychologist would see surgeons and pilots and other professional business people to assist them with dealing with ADD as adults and how to work with it and not need medication. So when I saw focus, NAD, I'm like, let's try it. What have I got to lose? It is absolutely extraordinary. The benefits are remarkable. I never expected it to turn out the way it did.
We've had other people also, you were mentioning pilots that have came in and not been able to take medication, and they've used NAD as well in the past with some really cool results because they're limited as far as what they can take and with regulations and that sort of thing. So go ahead.
Yeah, no, I mean, I would never have imagined just, outside of our friendship that you would have struggled with any kind of ADD. Like I said, your designs are some of the most amazing, spectacular designs. And so, and you do all of this by hand and, put a lot of time and effort into it. And so it's interesting that people don't realize like what some very creative people struggle with to make these things happen. And then, obviously, if you can't take medications to help with something like ADD, I think this is a nice, more natural alternative. And do you want to tell us a little bit about how this impacted your design process and the amount of time it takes you to do the designs now?
So just a brief rundown, when I would sit to do a design, I would still be thinking of 100 other things that needed to be done. So I would sit down, for 20 minutes and go, okay, I need to go put some clothes on. Or, okay, I can go down there and look and see what's on TV. Or I need to go lock the door. All these things that people with ADD have go through their minds. And the only way to really describe it is organized chaos in your mind. And so what NAD has done for me has allowed me to recognize the chaos that's in my mind and order the chaos. It doesn't make the chaos go away, but what it does, it allows me to go, okay, I can see this and I can see what's happening. And then I'm allowed to focus on where I'm going. So the drawings, I would get up, constantly move around. It would take forever to do design. Now I can sit down, focus on what I have going on, turn on my music, and I can draw. And I don't have to get up. I don't have to take all these insignificant breaks that mean absolutely nothing. And this is the first time in my 27-year career that I'm able to sit down and do a drawing and complete it at one sitting.
And I guess the chaos is also the beauty of your drawings.
Absolutely. It's ordered chaos is what it is. It's symphonic chaos.
Yeah. That's a beautiful way of saying it. That's what I'm going to tell Chris from now on when he tells me I'm disorganized. I'm going to say this is symphonic chaos.
Yeah, I actually am hoping that Jerry listens to this and will do this himself. The hardest thing I have convincing him to try NAD infusions is actually taking the time to do it. I mean, the infusions are a little bit longer than some of our traditional IV infusions. So you have to, take a few hours to slow down and get the infusion. And so that's one of the biggest obstacles I have to getting Jerry to try it. But he also has ADD. And the days that we're together in the clinic, it drives me crazy. Like, I'm like, you need Adderall, because as we're trying to get things done, he's like, wait, did you hear this? And he's like hearing a million conversations and every distraction is getting his attention. And so I really think he would benefit. But, from a time perspective, at least my observation is that is the biggest drawback to these infusions is you have to dedicate the time. It's something you got to plan and just in your self-care.
I will say this about the time. It is negligible compared to the benefits that NAD has provided me. And I go every 2 weeks, as you both well know, and I won't miss a session. It has ultimately changed my life, my outlook on life, my daily interactions with people. The time is negligible. It's worth it.
Have there been any bad side effects or unexpected side effects that you would say aren't pleasant with the infusions, either while getting them or afterwards?
For me, no. I understand there are people that do have some unusual feelings when the NAD has been administered through IV. I do not experience those side effects. It's actually quite euphoric for me to sit there for an hour and a half or 2 hours and take the IV injection. And when I feel these waves come on, it's just deep breaths, but it's extremely euphoric.
So what advice would you give to someone who's thinking about this or considering this? Would you tell them to go and try it, or do you?
I think NAD should be put in the water.
Nebulize the water.
I think it should be put in the water supply. I tell people about you guys all the time in Skin and Tonic, and I tell them, say, start off with 250 milligrams. Do that for a few weeks. Then go to 500. You'll notice you'll see the results start happening, and you'll go, okay, I can see this. And it'll be little moments of, oh, wow, there's clarity. Oh, wow, there's order. Oh, I love this. It's so worth it. And then I'm at 750 milligrams every 2 weeks now. I think that's the magic number for me. And so just take it slow. Don't give up on it at the first sign of, oh, this is a little unnerving. because it can be at first for some people. There's no pain associated with it, and it's just an unusual feeling, that's all.
It's one of those things that I think if people are prepared for it, and just when you came in the first time, I told you some of my experiences, which aren't quite as euphoric and pleasant as yours, but it takes me a much longer time to take a 500 milligram dose, for instance, than it does you, because it gives me a little bit of an anxious feeling, where it gives James a little bit of a relaxed feeling.
The first time I got him to try it, he told me I was locking his lungs down. That was exactly. He's like, "What are you doing to me? You're locking my lungs down." I'm like, "I'm not locking your lungs down. Take a deep breath and
I'm
calm
thinking
down."
about over the past 2 weeks, what have I done to deserve this?
Well, the good thing is all you do is reduce the flow, and it's instantly gone. So that's not a problem.
You've mentioned a lot of the mental benefits of it that you've experienced, which I think are huge, but you've also had a lot of physical changes just over the course of the short period of time actually that you've been doing it.
Absolutely, especially in the gym. I've been working out about 26, 27 years, and I have seen in the last, I guess, 5 or 6 months that I've been doing the NAD, I have put on 10 pounds of muscle. And I have changed nothing except increase the food in my diet, probably a little more purposeful in my workouts, but the NAD is creating faster muscle repair. The downtime in between working out that muscle group is shortened with NAD, and I have explosive results. My squat, I'm at 215 working out as a 50-year-old man, which is quite unique, and I don't use any other supplements other than hormone replacement therapy with a physician, and in low dosage with testosterone. But I've been doing that for 10 years. And when I saw the tremendous increase in muscle size, muscle repair, and strength is when I added NAD to that regimen.
Do I remember you telling me that you went from working out, pretty much daily to now sometimes you work out twice per day?
There are times when I do go twice a day because the repair is just so much faster. I don't have to wait 72 hours for a muscle group to repair itself with NAD. That is my experience. Now, that may not be the same experience with everybody, but again, I've been in the gym for 27 years, and I understand what happens in muscle repair, and downtime is important to let that muscle repair and grow. The length of time is not as important with the NAD that I've added to my regimen.
Well, thanks so much for being with us today. I know that we could sit and talk to you all day long, so we always enjoy visiting with you. And in fact, we'll get to hang out with you some in Key West soon. So we're
absolutely. I'm looking forward to it.
Any final thoughts, Jerry? Or?
No, I guess we won't talk about the Hemi engine that we discussed a little earlier.
Be more than happy to talk about it.
I guess we can. James, you want to elaborate?
Absolutely, be more than happy to. There's an old saying that you can't ever have too much money, okay? And you can take a good thing and make it even better. Have you never had any erectile dysfunction issues? And you and I had discussed P-Wave, P-Shot, which you both also offer at the clinic. And I was reluctant at first because, no man wants the thought of a P-Shot. But it took me some time, but after we discussed it, everything was fine. I decided to do it. What I've noticed, the P-Wave, and I'll let you guys talk about the science behind P-Wave and P-Shot. So we'll talk about the P-Shot with the NAD. It's incredible. I mean, it's turned me into feeling like a 25-year-old man again. And I'm shocked. I'm absolutely shocked. And I think it's the combination of the NAD, the P-Wave, and the P-Shot. And I won't miss it.
Yeah,
it's absolutely incredible.
It's interesting. And so for the listeners out there who are tuned in, Jerry and I developed a procedure, the Performance P-Wave, and it's based on science. It's been around for a while, and that's using a combination of plasma-based therapies and drawing your blood and re-injecting that into areas to stimulate growth. So that is the P-Shot, and we combine that with an ultrasound sound wave device that actually will stimulate blood flow and growth factors. And so I think probably what you're experiencing with this is that the NAD, there is some science to show that the NAD infusions actually will help the growth factor. So then when we do your PRP, when we draw your blood and prepare the PRP after NAD infusions, that maybe you're getting better results from that. So I'm glad to hear it. And maybe it's something that we'll look at incorporating into that procedure in the future.
Basically, this combination therapy that we've done is put a Hemi engine in his Rolls Royce.
That's exactly right. It's amazing. It's great to feel like a 25-year-old man again.
That's awesome. So, well, thank you again for coming. We certainly
Absolutely my
appreciate
pleasure.
your time.
Absolutely my pleasure.
And again, we want to thank James Martin for being here with us today. We certainly always love being around him and hearing his personal experience with NAD. I just want to take this moment as we close out this episode to remind you guys that anything that we talk about on the podcast is not meant to replace any medical advice that you will get from your provider. This is informational only. And while there are a ton of benefits associated with NAD, there are some risks associated with it. So be certain that you are seeking a medical provider that's trained in the administration of any medication or supplement that you're going to be ingesting or infusing into your body. We thank you for tuning in today, and we look forward to seeing you guys next week on another episode of Beauty in the Brain.